In fact, this is my after taking over this department, this is my first interaction with outside agencies. So it's a pleasure to be here with all of you today, and it's so heartening to see how you have already envisaged a future in the wellness and healthcare sector, and have planned this Vision 2030 document. I had seen snippets of it which Shekharji had shared with me, and it's a very interesting and a futuristic document that you have prepared. So it's very good to see that, and also to see all our team here. My entire Ayush team is here with all the departments concerned, and they're all part of this vision, and also for future, maybe future planning we all need to do. As you all know, Ayush is not just Ayurveda. It covers Unani, it covers naturopathy, and also other health and wellness systems that are there, including yoga. So it's not just our health. I think COVID made us, all of us, realize, and which has already been told before also, that it's not just curative health that we need to focus on. It's also about holistic wellness and a comprehensive system of health and well-being of the individual. So if and many times, even initially when I took over the department, there was a lot of even within the department, there is some distinction between allopathy and other systems of medicine. As you know, Ayurveda and all these systems have been in practice from 5,000 years, and in fact, the first surgeries were performed by Ayurvedic practitioners. So it is not a disjunctured system, and probably this is what we need to even bring forth in the common psyche of people, that these are not distinctive systems, whereas Ayurveda, Unani, Siddha, and naturopathy, all these focus on the well-being of individual. It starts as a preventive mechanism, and then when it is curative aspect, yes, we need to focus on allopathy because the results are probably instant. But that does not mean these two are cannot be used together, and we cannot use the common systems. So once we think of it in that way, in terms of a holistic well-being of a person, then I think we all will move much forward in integrating these systems. And that is a challenge for us. That is the first challenge. How do we integrate the allopathic systems with the traditional medicinal practices, and also these Ayush practices? So once we establish that continuum, we start with preventive care in with the systems of Ayurveda, Unani, and all these, and then when it comes to a serious issue, emergency issue, or kind of where you need very strong medication, then you move towards allopathy. Again, post-restorative health. Again, Ayush comes into play, where they can help you recover and rejuvenate and regenerate. So these are things where we need to establish that continuum. So if our vision is focused on establishing how we can integrate all these systems, I think we will move ahead much faster. And as is known everywhere, though government, especially Telangana government, has been doing a lot for healthcare, and there have been so many services provided which have not been there in. I can't see them in other states also, in fact. But still, there is a gap that, when somebody has a health emergency in their home, it actually breaks the bank for them. So that is what we are saying about affordable healthcare. And again, here also we should focus more on the well-being of individuals, the generic health of individuals. So through even now we do this thing called KCR kit, where we are taking care of the maternal health of mothers. So when the baby itself is in the womb, we start giving supplements, we start taking care. There is also parallelly an Ayush Ayurveda system where we strengthen the mother and we give maternal care. There's also homeo medicines for it, and also Unani. I think Dr. Bukhari will elaborate on that further. So these are all there. So these are things that we need to integrate. And if you look at it in the common psychology aspect also, nowadays people are again looking at generic wellness. They are trying to strengthen their health system. This psychology has also come in. The psyche is there. So we need to focus more on it and also develop standards in it. Today, if I open, actually, in fact, on the way here, I just was flipping through Amazon for something, and I ended up seeing a lot of generic medicines which were claiming to be Ayurvedic or claiming to be Unani medicines, but we don't know what is the efficacy of these medicines or the systems and standards of creating these medicines. So if they are not well created, in fact, one of my friends was sharing, once I just took over this department and she's an outsider, so she was telling me that they tried some Ayurvedic treatment for weight loss, which was bought off online. Some supplements were given to her, so instead of losing weight, she put on another 10 kilos. So she was sharing that. So then I realized that, I mean, since I'm talking to a trade body here, there are many trade practices which are probably not authentic. It needs to have more standardization, more research on how the drug industry, especially the Ayush drug industry, also works. So that is the third thing that probably we all need to discuss in this discussion forum, that the Ayush industry is worth, I'm told, $10 billion. So, and it's going to grow. There is everything from memory increasing supplements to children to different kind of treatments which are being advertised indiscriminately. So we don't know what is correct, what is not. So we need to establish systems. We need to have standards of having, it is more or less there in allopathic medicines. It needs to further, we also have the Board of Indian Medicine, which certifies the doctors and the practitioners, and also how we give licenses to these practitioners. So apart from that, also the market industry, what is there in the market, we need to have standards for it. We need to establish, maybe as an industry body, you can ideate further and tell us on how, what is the way forward in this direction. So that is one thought I leave you with. And also, when we are talking of affordable health care, like you said, we have around 800 Ayush wellness centers across the districts. So apart from our referral hospitals, which we have around 5 referral hospitals across the state, both Ayurveda, Homeo and Unani, also one of the naturopathy hospitals that we have. We also have different wellness centers across, and they are all equipped with practitioners. We have doctors, qualified Ayush doctors in all these wellness centers. So these centers are already there, and also they have helpers, they have pharmacists, and we have pharmacy prescriptions which are given in all these wellness centers. But we need to activate it further. We need to see that we reach the last mile. And we also need to see that like Shekharji was pointing out, that we need to reach out to the last person, and each and every person is availed of these benefits. So reaching out to schools, that is something we are contemplating from the department itself, where we incorporate it in the lifestyle of individuals, Ayush practices. So we start with maternal care, we start with school children, and Ayush has lot of benefit for geriatric care. and we are a country which is slowly aging, and the aging population is increasing. So we need to have a focus on geriatric care and how we can increase. Maybe one of the thoughts we can think of is having geriatric centers in places across maybe district headquarters and all that. We can always plan to do that. That's also a part of the Ayush mission, which is given by the government for us. So we are all planning on these factors. So these things we can do, and as an industry body, I think bringing in standards, norms, and how we can regulate the illegal use of Ayush names is something we can think of, because there are so many genuine practitioners out here, and they are in fact no doctor in all these systems, including naturopathy, goes out without 5 years of training equivalent to an MBBS doctor. So they're no less. The only thing is we need to come out with the practice systems, and we need to regulate the way it is practiced. There are natural practitioners also. I don't deny some of them can be those age-old naturopathy practitioners. They also have their systems. So how do we bring a little more standardization into it? How do we bring it to the forefront? And once, if some practice like this, like the example I gave you before, when somebody is, the medicine has not given the desired result, when such things happen, again people would start doubting the system itself. So these are things that we need to focus on how to control them, because now with digital interventions, people can buy anything from anywhere. So what is to be bought? How you can buy it, and is it certified? So many people don't even know that there is. I mean, they might know some practitioners, but they wouldn't know how many government hospitals are there, where to reach them. All are dispensaries, in fact. So that's one thought that we were also having, that we should popularize our dispensaries. If you just click on some app, they can take you to a dispensary. That's something we need to work on. If we can work on with your team also, that will be wonderful. So these are some of the thoughts that I leave you with. There'll be, I'm sure, all the practitioners are here. They've been here for many years in the service of the sector. So they will also have some ideas, and they will have thoughts. My team is here. Our director Homeo is here. Our director Unani is here, and also director Ayurveda. AD, all of them are there. So they'll all help you, and all our doctors' teams are also here. So I think the discussion will go on much further. So thank you one and all for participating in this discussion, all of you. It's actually been an interesting ideation session for me. So we've got so many ideas. I think it's like a board discussion where we could get some thoughts in process. Now we have to realize them, and we also have to see what is the action and way forward. So few things which have come up, and how we can popularize telemedicine, especially, I think seems to be very popular. So we need to explore that option, and other options also which have come up, like the psychiatry treatments, and also how to integrate Ayush with the regular medical practices. So these are things which are all very interesting, and good ideas have come up in this process. So maybe we need to work in where we can bring in the private sector into this, where we can collaborate further on these aspects that we have discussed. And also the best practices which are already there in the private sector, maybe how we can integrate them into the government system. So these are things we need to explore, and further discussions maybe we can facilitate once we start off on these points. Health camps, I think you can immediately start. That is something which is a low hanging fruit. So all of us can easily do that, and we can move forward on exploring telemedicine. That can be a next possible sector in terms of collaboration. And then after that, also these clinics that we thought about, and maybe how to build up a system of repository for these Indian systems of medicine. So we can all try these and explore further. It's been a very interesting discussion. So we again, from our team side, we compliment FTCCI for getting us onto this platform and making us interact with each other. Thank you.